Welcome to the Yvonne Candy Show. Motivational, inspirational, and just plain fun. Where celebrities check in and you can check out what's fresh in entertainment, business, health, finance, and more. It's all about your lifestyle. Here's your host, Yvonne Candy.
Hi guys, I hope you all are well and will continue to be so. Since our last show, I had a family member who doesn't live in my household, by the way, was admitted to the hospital with coronavirus. Now, they were very sick, and at home, there was no fever over 100 and no shortness of breath. So they were thinking that they had another illness, not the coronavirus. So guys, don't take it for granted that you are sick with another illness, because the coronavirus can come with various and different symptoms. Our next guest is going to be talking about a subject that I really enjoy. We'll have Mike Roberts on the show, who is a financial expert for over 32 years. And he also is an insurance expert. Mike will be telling us how we can grow, transfer, and build wealth, whether we're an individual or a business owner. And next we'll have Dr. Bindiya, holistic physician, that is going to be talking about some alternative ways to health problems and how you can stay healthy, all coming up right after this message.
Are you an investor in need of someone who can find the right properties, negotiate the best deals, and sell your properties fast? Look no further than a Long & Foster or Christie's International Realtor to help you with your investment needs. Call 610-750-9669. That's 610-750-9669 for Long & Foster or Christie's International Realtor.
You're listening to the Yvonne Candy Show, where it's all about your lifestyle.
And we are back with financial and insurance expert Mike Roberts. Welcome to the show, Mike.
Hi, good afternoon.
I understand that you've been in the consulting business for over 32 years and you work with commercial and individual clients. Tell us about that.
Yes, thank you so much. I've been in the insurance business, consulting and helping clients for 32 years. What I've learned is that everybody's needs are different, whether they own a business, whether they work at a company. I work with people basically from the mailroom to the boardroom, and I help them transfer risk using insurance products.
Now, you handle commercial and individual. Tell us what's the difference between what you're going to be doing for each type of those clients.
So the commercial business, just so we're clear, is normally called property and casualty, and they insure things. They insure your car, your house, your boat. The individual business and the business of benefits is where I specialize, and that's where we insure people's income with life insurance. If someone was to pass away, we insure partnerships in a business where partners can insure each other so that they don't have to be in business with their partner's spouse if something happens. We help protect income if they get ill. So life insurance is what we call morbidity and mortality. Morbidity is health, mortality is life and death. So we insure for both.
Tell us what's the process for insuring wealth or assets. You have your home. How do you protect these things?
It's a great question. When someone has a home and they have a mortgage, obviously we all go to work every day and we all do different things, but at the end of the day, the byproduct is money. We take that money and we pay our mortgage, we make our car payment, we buy clothes, we buy food, we entertain. Hopefully one day we'll travel again. So what we do is I will do an analysis for somebody and find out what it is they do for a living and how much they earn and what their bills are. We do basically a monthly expense sheet, and then I design programs that in the event of a death or a disability, someone dies or they can't work, we provide an income and we provide a check. We bring the money. I'm the one that brings the check so that in the event of a death or a disability, bills can get paid. Basically, we're in the business of making dreams come true, because what I've learned is over the years, in 32 years, when I go to a funeral, as morbid as that may sound, I'm the only one that brings a check.
Right. But is there an income that's too small to even put a financial plan together? Because a lot of people think, I just don't make enough money.
It's interesting. I find that the people that make the average person, and again, average is let's just call it the mean average in the United States, the income is in the $40,000 range. That person needs insurance worse than a person making $400,000. And I'll tell you why. Somebody making $40,000, $50,000, $60,000, $70,000, even $100,000 a year today needs to protect that worse than a wealthy person just because they don't have the ability to save and have a safety net. Insurance is that safety net for their family. So again, I work with people from the mailroom to the boardroom, and the mailroom needs me much more.
Is it all about income, or do you try to protect individual assets? For instance, like say you have a real estate investor, you may have someone that has a shore house or whatever. Are you protecting the income from those properties or your individual income that would pay the debt of those properties?
Well, I personally would work with them to protect the asset, the earning of what they're making the money to pay to protect that asset. But I have a team of associates that do the actual homeowner's insurance, the auto insurance, the boat insurance, because it does take a team. Nobody can do everything. Nobody can do every product line. So we have a team of experts. I personally would work with somebody to protect their income, to make sure in the event of a death or disability, money was provided, or as someone got older, to protect their income and their assets, and more importantly, their dignity with long-term care, depending upon their age or their parents, or design a program that will create an income for life. But if we're talking about protecting an actual home, you mentioned the shore house, a primary residence, a real estate investment, that's the other part of my team.
Yeah, it could be a apartment building or something like that. So in other words,
Yeah.
I just wanted to get this clear. So you're not only writing policies for your income, you're writing policies for individual assets like your boat or the apartment building, maybe the income from the apartment building. But then when it comes down to the boat and your primary residence, they would be individual policies. Is that correct?
That's correct. Any word, any product, any program that has the word insurance in it, homeowners insurance, auto insurance, boat insurance, life insurance, disability insurance, long-term care insurance. If the word insurance is in it, then we have a team member that does it.
How do we transfer wealth? How is that done?
The way that wealth is transferred is a number of ways, depending upon the complexity of a person's estate. If they've accumulated assets and they're successful, what we would do is we normally put things like life insurance into a trust, and that's where we work with attorneys. Primarily what we're doing is we're creating a legacy. That's how we call it, creating a legacy. When you have a life insurance policy, for example, and someone of wealth passes away, if they have a wealth greater than $5 million, currently I think it's $5.5 million, and they're married, a couple would have a $10 million wash, if you will. Husband dies, everything goes to the wife. Wife dies, everything goes to the husband. But what happens if the husband and the wife die and they have children? Then the money transfers to the children. That's where your partner steps in, and your partner's Uncle Sam. What we do is to create wealth and transfer wealth is we would write an insurance policy on the husband and the wife to replace the bite that Uncle Sam takes out of it. So if, let's say you had a $15 million estate and the first $10 million transferred, there's still $5 million. You want that $5 million to go to your children and your grandchildren in most cases. Uncle Sam says, no, not so fast. We want half of that. So we would replace the piece that Uncle Sam took with a life insurance policy. They're called 25-cent dollars because in most cases, for every 25 cents that you spend, you will get $1 back in return from life insurance.
Wow, that's powerful, because a lot of people, they want to set up trusts, but they're missing that piece right there, because they know that they're going to be, their beneficiaries are going to be taxed on whatever they get. So the missing piece to the puzzle is here, how can you reduce those taxes? And
Right. Well, you reduce the taxes as many ways as you can legally. There's something like 77 tax loopholes in the tax code, and we use the word loophole. Now, that's where the accountants and the attorneys come in, and we work hand in hand with them to create a program, and we take advantage of every loophole legally that's possible. And then at the end of the day, the bottom line is we'll determine how much insurance we need. And just to be clear, life insurance proceeds in most cases, 99% of the time, are income tax free. So when you pass and you leave $1 million life insurance policy to a wife or a child, they do not pay income tax on that.
Right, right. What I like about trust, though, is that you can designate anything that you want to about how you want that money to be distributed after your death.
Very important.
I love that because you don't have to give each one of your children, and believe me, I'm not the expert here, but I do have I do have some trust, and I just, this is my thing. I just love anything that have to do with financial planning.
Do you remember there was an old television show called Chiller Theater?
Chiller Theater. That sounds familiar. Yes.
So the opening scene, a hand with 6 fingers, not 5. 6 fingers would come out of the ground as if it was coming out of a grave, and there's this hand. Oh, yeah. And I love that. I love that because what I say to people is, if you use a trust properly, your hand is going to come out of the grave after you pass, and it's going to point. It's going to point to people and say, "You get this, you get this, and you get this." That's what a trust does. You're absolutely right. It allows you to control the money after you've passed.
That's right.
That's what a trust does. So I love that visual. I didn't like you so much. You ain't getting anything. You're getting the car, you're getting the house, and you're getting the money.
Right.
That's what a trust does. One of the things that people also don't realize, trusts are very difficult to sue. Okay, you can't get money out of a trust. Everybody's familiar with O.J. Simpson. And O.J. Simpson had some very, very good financial planning advice because it turns out at the end of the day, he not only had a number of trusts owning his assets and controlling things, he had annuities, which are insurance products, inside of a trust. Very, very difficult for creditors to get at.
Wow.
So in a divorce situation, you do want trust because they're not subject to creditors and they can't just be easily invaded. And trusts are also, when set up properly for life insurance, they're not taxable events. So a life insurance policy in a trust is not a taxable event, and the life insurance is income tax free. So it's almost a double shield.
Wow.
Again, this all comes into part of the planning process.
Good information. Good information. People have to talk to people like you when they're going to be setting up trust, because just that little bit of information right there, I would have never thought of. So, this is really important when you're talking about saving money. If you're going to obtain, or if you're planning to obtaining any type of wealth, you need to get started even at the lowest point or the smallest income. You need to get started on education. That's why people like Mike is good to talk to, because there's several different ways. Like, how many loopholes you said it was again, Mike?
Somewhere in the area of 78 or 79 legal tax loopholes in the current tax code where you're allowed to transfer wealth. And for instance, have you heard the term family limited partnership, an FLP? Right. So basically, it's just a word to most people. But in a family limited partnership, when you set up a company structure, and it can be a mom and pop business, when you set it up as an FLP, a family limited partnership, you immediately get a 35% tax deduction on the value of the business, because what you're doing is you're breaking up the company into slices. Think of a pie, a pizza with slices. When you put a company into the pizza and you break it up into slices, you no longer have a whole pie because you've distributed ownership in the pie. It's not taxable as a whole pie anymore. And it's just something simple like that you can do, with proper accounting and legal counsel.
Right. I wouldn't know 78 loopholes. I wouldn't even know where to start. I mean, that's right. So that's your job. You deal with this every day, and so you would know what loopholes to look for an individual. And by the way, and Mike and I were talking about this a little bit earlier, because I was telling him, look, everybody's situation is different. Do you create a plan for individuals according to their situation, their income, or whatever they're trying to do? He said yes. And this is great because you want someone that's able to create a plan specifically for you, not cookie cutter, not the guy down the street and maybe he has basically the same income and they're going to give you the same plan as the guy down the street. No, you want something for you and your family. Right, Mike?
Absolutely. Right now, I'm working, and you would think that someone in the insurance business would know this. I'm working with a small insurance brokerage business in Atlantic City, and it's a father and a son and two partners. Their needs are completely different than the electrician and his wife that I'm getting quotes for right now. He's an electrician. He works at a university. He makes about $70,000 a year. His wife's a teacher. She makes $90,000 a year. They have two children. So their needs are very different than the guy who owns an insurance brokerage firm who's making $5 million a year. With him, we need to protect the partnership. It's a different type of sale, and it's a different need. Everybody's needs are different. That's why each case is individual, each case is handled differently, and each case gets designed differently because people's needs are different. People's budgets are different. Everybody deserves the same attention. They just don't get the same plan because their needs are different.
You know, on the other hand, outside of the partnership between a husband and a wife, if one or both own a business with somebody else, it's very important that you protect yourself because what if that other person dies?
In a situation like what you're saying, in a situation where there's partners in a business, so it's a great question because what happens is, let's just assume you and I own a widget company and we're 50-50 partners in the widget company and I pass away. First of all, you don't want to be partners with my wife. You never liked her anyhow, right? And now it's like, I'm not going to be partners with her.
Right.
And she knows nothing about the business. So we would have an agreement called the buy-sell agreement. It's not that, hard to figure out buy-sell. So what happens is I die. We have an agreement in place, and we've insured the value of the company. Let's just say our company's worth $1 million. I owned half, you owned half. So I own a $500,000 policy on you, and you own a $500,000 policy on me. And when I die, you get $500,000 from the insurance company. You take that to my wife. You go, give me my shares. And she goes, why? Because I got $500,000 here for you. And she goes, good. Where do I sign? You give her the $500,000, you get the shares, you own 100% of the company. What happens is if you don't have an agreement and you don't have insurance, you're partners with my wife. And you're not going to pay her, and she's going to sue you. And let's not forget our partner. Remember I talked earlier about our partner, Uncle Sam? You've got 9 months to settle up any transfer of assets with the IRS. And if you don't have insurance to fund the transfer of the asset, you're paying for it out of your pocket. So the IRS, as crazy as it sounds, will put you out of business for taking over a business when a partner dies if you don't have the money to transfer the asset. And I've seen it happen time and time again.
Now, would you do the partnership agreement or the insurance part of the partnership agreement? Because I thought that was something that maybe attorneys do. Or would you work with the attorney?
I work with attorneys. Yeah,
right.
I work with attorneys. What I do is I provide my clients with what we call boilerplate documents. These are standard accepted documents that would give you blank spaces where to fill out, but it has to be approved and signed off by an attorney. We also do something called business valuations. And what that means is we'll come in and we'll value your business and we'll tell you what the business is worth, because most business owners don't have a clue what their business is really worth. And we do that for free. It's a service that we provide because that becomes part of the legal document. Where did we get this number? How did we arrive at this figure? We have to be able to justify that, we being the insurance consultant, because the insurance company is going to approve it and underwrite it. So that becomes part of a legal document. So we provide business valuation services for companies. And all we need is 3 years corporate tax returns.
Oh, fantastic. I wanted to ask you, how is the coronavirus affecting the insurance industry these days?
The coronavirus is affecting the insurance industry these days in my world in a number of ways. First and foremost, I just want to let everybody know, if they currently have a life insurance or a disability policy, they're covered. Okay, if something happens to them due to COVID-19, they're covered. Going forward, they will be covered, but all new life policies have what's called a 2-year contestability period. So if they traveled abroad and they've got a new policy and they didn't admit that they traveled abroad, there might be some questions about that. Certain carriers are now limiting new policies. Some insurance companies aren't going to write people that are 80 years old or older. So if you're turning 80 in the next year, you might want to think about getting insurance now. In terms of the elderly, we hear what's going on with all the nursing homes, unfortunately, and assisted living facilities. One of the most important products today that's been brought to light, especially in the current pandemic with COVID-19, is long-term care insurance. That's a program, that's an insurance policy that gives you money each month to pay for the care of a loved one or an elderly parent. Long-term care insurance does not just pay in a long-term care facility. Long-term care insurance will pay for the care at home, at an adult center in the community, at an assisted living community center, or a long-term care facility. Long-term care, just so we're clear, is acute care. It's medical care. It's where you need a doctor. It's where you need a nurse, but you don't need to be in a hospital. So long-term care policies today cover many, many different things. And the average cost of care today in assisted living in the New York, New Jersey, Philadelphia metropolitan area, a decent type of facility for assisted living is anywhere between $6,000 and $10,000 a month. So unless you've got $200,000, $300,000, $400,000 saved and put aside for care, you really need to transfer that risk to an insurance company.
So in other words, if you had purchased a new life insurance policy, there could be a 2-year holdback. Is that right?
All life insurance policies, this is nothing new. All life insurance policies, when purchased, have what's called a 2-year contestability period, where if you lied on an application and the insurance company did not pick it up and you got a policy and you die in the first 2 years and they can prove that you lied, they will return the premiums you paid to your family or to your partner, and they won't pay the claim. In 32 years, that's never happened, but I'm sure it's happened in the past, which is why they have a 2-year contestability period. You cannot also buy a policy and commit suicide in the first 2 years. If you buy a policy and commit suicide, they will return the premiums. Most insurance companies know that if you're going to commit suicide, you're not waiting 2 years.
Well, what if you commit suicide after the 2 years?
Then all bets are off. They got to pay. They won't pay either if you kill your spouse. Okay, you can't. They don't pay policies in the commission of a crime. One of the things we talked about life insurance, which is basically if you died. We talked about disability insurance, which is if you need to replace your income if you're sick or have an accident. We talked a little bit about long-term care insurance, which again I tell it's asset and dignity protection. The other thing we should talk about is an annuity. And an annuity is an insurance product that you fund while you're alive with either savings, either a rollover from a retirement account, a 401k or an IRA, and it's fully insured. Think about what happened in the market the last 3 weeks. If you had money in an annuity, you didn't lose any of your principal, zero. There's a zero floor. So any money in an annuity you can never, ever lose. Okay, there are different types of annuities. That's how you earn money in an annuity, and that's a specific conversation to have. But if someone's either being furloughed or laid off, and they have any questions about life insurance, disability, long-term care, or an annuity, or how to roll over their retirement plan and guarantee an income for life, that's a conversation we should have.
With the coronavirus pandemic, is it possible to get life insurance?
It is. Currently, under the current pandemic, a lot of insurance companies have gone to what's called non-medical underwriting. I don't know if you've ever purchased life insurance before. Normally, someone would come to your home or business, and you would basically give them, medical samples, labs. They would draw blood. They would ask you medical questions. They might weigh you, do an EKG. That's not happening right now for two reasons. A lot of people have no interest in having a stranger come to their house and touch them. And the insurance company has gone what's called non-med underwriting. So if you're a fairly healthy person, ages 18 to 65, and wanted to get $500,000 or $3 million of insurance, we have carriers that are doing non-medical express e-ticket, it's called electronic ticket underwriting or accelerated underwriting. So yes, insurance companies are open for business. They're writing new policies, and it's actually never, ever been easier to get life insurance.
Wow, I would think it would be just the opposite. That's amazing.
Yeah, it is wild. I got to tell you, Yvonne, my phone's ringing off the hook. I've been so busy, I didn't even know the word Zoom. I'd never had a Zoom meeting in my life 3 weeks ago, and I've been on Zoom meetings every day for the past 3 weeks with people going, how do I get insurance? What do I do for my employees? How can I help? What do I need to do? Companies, you asked about companies before. Company-sponsored plans. I have a company in Reading, PA. They have 110 employees, and the owner wants to do something for his employees. Thank God, they're okay, and they're not going to lay anybody off, and they want to say thank you to their employees. So because it's a company-sponsored plan, I can get all 110 employees $300,000 of new guaranteed issue underwriting insurance, no test, nothing. The company's paying for it, so they'll give them $300,000 of life insurance. If it was voluntary, if they just offered it, but the employees paid for it, $100,000 of guaranteed life. So it's never been easier.
But aren't they expensive? Because that could be, $200 or $300 a month?
Not at all. In the group chassis and these types of programs, we use a different type of product, and basically it's not that expensive, but each case is different.
Right.
If someone was interested and wanted to find out about it, then all they would need to do is reach out, and we tell them what information we need. We collect census data, and we provide a quote.
But again, there is a 2-year waiting period. Is that correct?
But that's on every policy. That's not new. That has nothing to do with COVID. Yeah, if you had just called me up out of the blue and said, you basically opened up the phone book, turned the pages to life insurance, put your finger down, and my name was there. And you said, oh, Mike Roberts, I like the name of it. I like the sound of that name. And you called me up and you bought a life insurance policy for me. Whether it was last year, 5 years ago, or tomorrow, there's a 2-year contestability period. And all that is the insurance company saying, look, you can't tell me you want a non-smoker policy when you sneak 3 or 4 cigarettes a day.
Well, look, they can tell anyway when you die. I mean,
right. Well, that's my point.
Yeah.
They can't tell pre, but when you go for a test,
right,
nicotine shows up in the urine. That's how they know you're a smoker.
Okay. Yeah, that's right.
It's kind of like this. I tell people, you're not a little bit pregnant. You're not a little bit diabetic, right? You either are or you aren't. You're diabetic or you're not. You're pregnant or you're not.
Right.
You're a smoker or you're not. There are companies, as crazy as this may sound to you, not for cigarettes, for cigars, for pipe, for chew. For those 3 products, all nicotine-based, I can get non-smoker rates.
Wow.
Wait, I'll go one better. 5 years ago, 10 years ago, you could not get insurance if you had HIV. There are carriers today that will write you with HIV.
Thank you so much, Mike Roberts, for joining us today. Can you give everyone your contact information, website, anything you would like to give?
Sure. You can reach Mike Roberts at CPT, Create, Protect, and Transfer Wealth. My email address is cptwealth, cptwealth@gmail.com. The best way to reach me directly is on my cell phone, area code 917-328-4904. So you can either email me, call me, or text me, and I will get back to you within 24 hours. If you do call me, let me know that you met me on Yvonne's show, and I just want to give her credit and kudos. And I look forward to answering any questions anybody has. Nobody's too small. Nobody's too big.
Well, thank you so much, Mike. I love this subject, and I look forward to talking to you again soon.
Excellent. Thank you very much, and everybody, please stay healthy and be well, and wash your hands a lot and practice social distancing, and let's get back to normal.
Coming up is Dr. Bindiya Gandhi, holistic physician, to talk about alternative ways to health problems and how you can stay healthy right after this message.
Are you an investor in need of someone who can find the right properties, negotiate the best deals, and sell your properties fast? Look no further than a Long & Foster or Christie's International Realtor to help you with your investment needs. Call 610-750-9669. That's 610-750-9669 for Long & Foster or Christie's International Realtor.
You're listening to The Yvonne Candy Show, where it's all about your lifestyle.
And we are back with our guest, Dr. Bindiya Gandhi. Welcome to the show, Dr. Gandhi.
Thanks for having me on today.
Can you tell us a little bit about yourself and your medical background?
Yes, so I am actually an integrative medicine doctor as well as a family medicine doctor. I'm board certified in both. And I've been practicing this way for about maybe 8 years now. And this is kind of all I do. And I merge traditional medicine with conventional medicine along with integrative functional medicine.
And why did you choose the holistic way?
So I actually chose this route because I knew the traditional model was kind of broken, and I knew it just wasn't right. I remember in medical school, my pharmacology professor going through medications and explaining the mechanism of action, and specifically, we were talking about high blood pressure medications and how some of the medications would have these side effects. But he explained it as, they're not really side effects. It's the mechanism of action, meaning this is what is supposed to happen. So we'll give someone a medication for, say, high blood pressure, and now they're coming in for leg swelling. Eventually, at some point, they're gonna come in. So they may not complain of that side effect first 2 times you see them, but maybe by the 10th time you follow up with them, they'll complain of it. So it's kind of inevitable. And I knew that was not right. And this is also the same time I was kind of really getting into yoga and meditation just to kind of manage my own stressors in medical school. And I just kind of kept digging deeper and realized there was this whole other world out there that was called integrative functional medicine that incorporated more of these holistic practices. And I was like, oh my God, I've got to do this. This is the type of medicine I want to practice. I don't want to just keep prescribing medications. And then, honestly, it kind of validated it more when I was in residency, and I ended up having like this rash that nobody could figure out. I went to a really great residency program, and I went to all the top doctors there, and I tried every pharmaceutical agent from antiviral medication, topical ointment, steroids, you name it, I tried it, and nothing worked for my rash. And again, it was because of integrative functional medicine. I realized a couple things. I ended up having celiac and food sensitivities and a lot of other things going on. And that's why I have rash. And it was I kind of felt in a way that traditional medicine had failed me, even though I was a doctor and I was practicing this way and I was treating my patients this way, when it came to healing myself, I had to kind of dig deeper and take a different approach.
Yeah, you were looking for options and better ways.
Exactly.
Right. And it's funny because a lot of traditional medicine does have natural products in it. All of it isn't, chemically made.
Exactly. Yep.
I understand why you chose holistic medicine, but tell us what the difference between holistic and traditional.
So there's a need for both. I want to start off by saying that, and I am a medical doctor, and I am, board certified in family medicine. So, that is your primary care doctor. That is your basic bread and butter of primary care. The difference is when I, look at symptoms, like if you come in for saying you've got headache, the traditional doctor may just say, here's a headache medicine, have a good day, right? when I see you, and the holistic approach is, okay, I see you have headaches, well, let's figure out why you have headaches. It's kind of like, let's not just stop here and give you a medication for a headache that's digging deeper and saying, well, let's figure out why you have headaches. Is it because you have food sensitivity? Is it affected by your hormones? Because as we age or different periods in our life, our hormones can be triggered at headaches. Is it something you're eating? Is it because you're stressed? It's kind of like it's digging deeper to figure out why particularly you're having headaches, right? So it's taking a well-rounded approach to see how we can get that headache gone. Like for figuring out why you have a headache. So it's not just covering it up with a medication. It's, getting to the point where it's like, well, we don't ever want you to have headaches again. So if we know why you have a headache and what's triggering and causing your headache, then we can deal with that, right? Makes more sense.
Well, would you say that you do the same thing with traditional practicing?
So traditional practicing, for me, I've kind of merged both worlds, right? Because I've been practicing this way for a while, so it's more natural instinct to say, okay, I'm not a pill pusher, right? So if people come to see me and they're telling me they have a headache, I'm not going to automatically say, well, here's this headache medication. Have a good day. I tend to dig deeper with all my patients,
right?
Because it's kind of when you have that knowledge, you don't just stop and practice a different way, if that makes sense.
Yeah, you take it the extra yard.
Yeah, exactly.
You go the extra mile. I can understand that. Do you find that the holistic way is considered more natural, less harmful, or less invasive than the traditional practice of medicine?
Yeah, I definitely would agree with that. It's definitely less harmful. Now, it's also less harmful if you're working with a provider who is knowledgeable. A lot of times, people practice, or they think that they can go to a health food store and they can take all these supplements, right? But unfortunately, that can be harmful, right? If you're not taking the right type of supplements for you, it could become problematic. So traditionally, it should not cause you any harm, but if you're not doing it the right way, it could. The goal with holistic medicine basically is people are looking for alternatives. So when people we're looking for alternatives for surgery, or looking for alternatives to medications, or people want to come off of medications, or they want to avoid surgery, or whatever that is. That's when they come to me, right? They're looking for a different approach.
Well, that's great. Who would be a good candidate for a holistic medicine?
Honestly, everybody's a good candidate for holistic medicine. A lot of people come to me for different things. A lot of people come to me because they want to reverse autoimmune conditions. A lot of people come to me because they want to just be overall really healthy. A lot of people come to me because they want to get off of diabetes medication or blood medication. So I work very individually with different people to kind of meet their goals and their needs. So I see everybody from young kids, from like babies to elderly population, and we're focusing on different things with each of them.
I find that people take a lot of vitamins, but they really don't know what they need. Now, they could be taking vitamins. Okay, it may help them with their immune system or whatever. But suppose like you're taking a lot of vitamin C, or you're taking a lot of B12, and you really need vitamin D. How would you know what you need to take? And a lot of doctors don't even believe that vitamins help in the first place, but I believe that they do. So can you tell me if you believe that vitamins help, and how can they find out what they need?
So a lot of vitamins actually do help, right? Majority of my patients, I do blood work. So that's kind of the way I do things. I don't like to treat people blindly or just give people supplements or vitamins just because, right? I like to look at numbers. And so if someone's coming to me and we're kind of doing like a general panel and I'm checking their vitamin D level, and I see their vitamin D level is 7 and I know it should be above 60, I'm going to supplement it with vitamin D, right? Now, that being said, majority of my patients are vitamin D deficient, right? But there's a group of patients that I know, like vegetarians, people that are vegan, they tend to be, usually B12 deficient, right? So I'll encourage them to take B12, or sometimes even they're even iron deficient, have them take iron. But again, I like to look at blood work. Not every vegetarian or vegan is iron deficient. Not every vegetarian or vegan is B12 deficient, right? If they're getting They're eating, leafy greens that has iron, that has B vitamins. They're getting that through their diet. They may not need a supplement. So traditionally, we'll check certain things like vitamin D, we'll check vitamin B12, magnesium, zinc, just iron, that kind of thing. And that's typically stuff that, insurance will cover. I personally tend to like, in my functional medicine world, tend to like do fancier testing. They're called micronutrient testing. And we're looking at a very in-depth nutritional panel, and it's looking at, it's looking not just beyond the basics of vitamin D, but it's also looking at vitamin C, looking at protein, it's looking at your fatty acid index. So it's looking at manganese, it's looking at, calcium. It's looking at different micronutrients that we don't often look at, and in a more comprehensive way. So we know, okay, you need to substitute this to this. And so those are the tests I tend to kind of like for more depth, comprehensive analysis. And unfortunately, because insurance doesn't cover it, it is a little pricier, but the information you get out of it is very, very useful. So a lot of my patients, they do tend to like those tests as well because of how they can implement that into their lifestyle and their diet, saying, okay, I really need to focus on, a lot of times people don't realize, maybe you are, niacin deficient, and we're not checking niacin or B3 in the traditional panel.
Right, I agree. Now, I wanted to talk a little bit about this era of the coronavirus. I hear people taking loads of vitamin C, eating a lot of lemon or putting lemon in their tea. Tell me, do you think that this would help with the immune system to fight off the coronavirus or not?
Well, honestly, so there's a lot of things that you can do, not just taking supplements to boost your immune system. So, making sure you're sleeping well, making sure you're managing stress, making sure you're eating as healthy as can be. Those are just basic things to just stay healthy, right? And so those are things that are going to boost your immune system. Things that are showing to kind of be a little bit preventive, yes, is vitamin C. Vitamin C will definitely help shorten the duration of, the common cold and pneumonia. Melatonin seems to help. Melatonin is anti-inflammatory. A lot of people can take melatonin to help them go to sleep. Well, there's an added benefit. It can help with, possibly warding off the coronavirus and helping your immune system. Curcumin or turmeric is another good option that kind of helps with keeping your immune system healthy. So there are some options along with, maintaining a healthy lifestyle to kind of reduce your reduction in getting the coronavirus.
You said it would reduce the symptoms, do you think, with the coronavirus? Because some people get it really bad, and then some people just mild symptoms. So are you saying that to prevent from getting the worst symptoms of the coronavirus, that if you boost your immune system, that it would help with that?
Yeah. So what I encourage patients, look, even before the coronavirus, like even during cold and flu season, we want to optimize your immune system in general, right? We want you to stay healthy as much as you can. We don't want you getting sick, right? Because we know, regardless of what age you get sick, whether it's a mild sniffles, it's still not pleasant, right? So we want everybody to optimize their immune system. Now, if you happen to be in that higher risk category because you've got, chronic medical problems, you've got maybe diabetes, you're overweight, obese, you've got underlying heart disease or lung disease, even more reason that you want to keep your immune system healthy, because if you were to catch coronavirus, then you're more likely going to have a harder time than, say, someone that is more healthier than you.
And what about exercise? Do you think that works? Because even with underlying conditions like diabetes, high blood pressure, obesity, do you find that exercise is good also to help?
Yes. Exercise, yeah. So exercise is great. Exercise definitely has a lot of benefits. It reduces stress. It, makes you feel good, and it's honestly just keeping your immune system healthy, right? You're releasing endorphins. Lots of great benefits for exercise. The problem with exercise for some people is the extreme exercise.
Right.
So if you're doing you're training for an Ironman, right? And you're running 3 hours a day, that actually ends up being negative to the body, right? That actually the body perceives stress, and that actually weakens your immune system. But if you're running, 3 times a week for 30 minutes, that's actually great for your immune system. So again, extremes of exercise can be negative.
I don't think that exercising too much is actually good for the immune system. And even exercising while you're sick.
Yeah.
You know, you're the doctor,
Yeah.
but what I'm saying is I don't think you should exercise when you're sick. That doesn't make sense to me.
Yeah, and again, it depends on what type of exercise you're doing, right? You know, it depends. Are you doing high intensity workouts, or are you going for a walk? You know, going for a walk if you've got sniffles, maybe okay, right? But you know, most of the time, if you're sick, you probably don't even have the energy to want to work out, right? So, kind of goes together.
Yeah, I mean, some people think if they miss their workout, they're going to die. Okay, if you're sick with the
No.
cold, or you got a virus, or you got a flu, or whatever, why are
Your
you
body
going?
needs rest. Yeah.
Yeah, I mean, why are you going to do an intense exercise? I don't get that. What are some of the vitamins that you think, or maybe even any other type of treatments that you think that you can do to help with the coronavirus? I don't know that we covered that a little while ago, but let me know if
No,
it's...
that's a great question.
Yeah.
No, that's a great question because there are some things that I recommend. So if you have the coronavirus and you have tested positive, you know, besides taking some of the supplements we talked about, which are the vitamin C, the melatonin, the turmeric, those are all great. You know, making sure your vitamin D level is optimized, right? I want to make sure that you're taking vitamin D, especially if you find that you're coronavirus positive. I probably have you take things like angiographic, probably have you take things like medicine. Those really help. Having you taking zinc, vitamin A. So there are some things that I probably have you take because we want to keep your immune system even healthier, even stronger, because we really want you to fight this virus. More reasons of why what would love for people to take vitamin C, because studies have shown that it actually decreases the duration of pneumonia and it actually decreases symptoms of acute lung injury. So especially with coronavirus, we know that it can turn into pneumonia and it can cause lung issues. Vitamin C is very, very important.
Now, this is, you said this is when you're tested positive, but what if you're not tested positive? Can you take the same thing to try to prevent the coronavirus?
Yeah, I mean, we do have some people, you can definitely take some of these supplements as well. But, I'll be honest, even with myself and the majority of the patients, people get tired of taking supplements. People are already taking a few supplements. By the time we add all these other supplements for their immunity or to prevent the coronavirus, they're taking like 20 supplements a day. People get what we call supplement fatigue, and they're just like, I can't take anymore. So, my whole theory behind it is, less is more. Try to eat as healthy as you can. Make your nutrition your supplements, right? Make your nutrition a priority. And then, if needed, if we think that you feel like you're coming on with a cold or you've been exposed to someone that had the coronavirus, then definitely up it and take it.
I get tired of pills. I don't care what it is. It could be.
Yeah, it is. I agree. Yeah.
I mean, some people take 18 vitamins a day. And look, I'm not far from it. I just can't take it. Do you have an easier solution? Yeah, I mean, it's just crazy. It's crazy.
It is. One of the things that I say is let's prioritize and see what is it that your body needs. Again, this is where that individual lab testing comes into play, right? So if I know you're someone that I've done your labs before and I know you're zinc deficient, I want you to take zinc during this time because zinc is great for your immune system. And if your vitamin D is optimized and your vitamin D is like 67, maybe I won't have you take a vitamin D or a high dose to have you take one. It won't be a very high dose of vitamin D, right? But the other things that I recommend for people is to kind of space your vitamins or your medications and supplements throughout the whole day. So you're not taking 10 pills at one time, right? And spreading it throughout the day kind of makes it seem a little bit better. It still sucks, by all means. It's still not pleasant, but at least it's not like you're gagging every time you're taking like 5 pills at a time, if that makes sense.
Oh, my goodness. And that vitamin C, the pills are so big.
They're big.
Oh.
Yeah, that's actually why sometimes I'm a big fan of at our clinic, we do vitamin C infusions, IVs. And so you're getting really, really large doses of IV vitamin C. You're not having to take a pill. The absorption is a lot better and it's well tolerated. So, that's where we do get a little bit fancier, and we even at our clinic we have vitamin D injections. We have certain vitamin B injections. So iron injections for people that can't tolerate iron. So we do have other options, and other options are available out there as well.
Yes. Is this a responsibility for the patients to pay for it, or would your insurance cover that?
No, unfortunately, insurance does not cover this kind of stuff. Technically, insurance doesn't really cover integrative and functional medicine. Insurance covers, basic, primary care visits, but when it goes into integrative functional medicine or more beyond, and we're talking about more prevention, we're talking beyond wellness. So not the physical exam, which is considered wellness, but we're talking about like optimizing wellness, where the doctor spends over an hour with you. Unfortunately, insurance doesn't cover those kind of services.
Yeah, it's almost like not covering cosmetic surgery. They're not going to cover
Exactly.
that. Yeah, same type of
Yeah.
thing. And one of the questions that I meant to ask you earlier was, when is it time to go from holistic medicine to traditional medicine with your patients? Do you mix the two, or do you have a patient that might be too sick for holistic medicine and you have to switch over to traditional medicine? How would you treat that patient?
So that's a really great question. So in my practice, I see patients that have a mix of everything, right? I see some patients because all we do is primary care because they don't really want to come off of their medication. We're kind of just managing their diabetes. Maybe they're not ready to kind of make these lifestyle changes, right? And then I have some people that all we're doing is we're just doing holistic medicine. They are very anti-medications. They are like gung-ho about changing their lifestyle, and that's all we do. Then I have some patients that we're kind of back and forth. We're balancing between traditional medicine and holistic medicine. So maybe they have, we're trying to come off of medication. So we're kind of merging both worlds, or we're doing some holistic stuff, but they have they get an infection. Like maybe they get pneumonia. So now I'm putting them on an antibiotic. So, there is a need for both. Understand that there is a need for conventional medicine, even more so now than ever, because conventional medicine is great for acute medical problems. So your urinary tract infections, your pneumonias, that kind of thing. That's where acute medicine comes in, and you need the antibiotics. But if we're dealing with things like rheumatoid arthritis, or we're dealing with psoriasis, or we're dealing with diabetes. That's what we call chronic medical disease management, and we can treat a lot of that using holistic medicine, or taking that holistic natural approach.
Great. I want to go back to the coronavirus for a second. What the doctors are saying is, okay, if you're tested positive, you go home, you stay in quarantine, but when is it time to go to the hospital?
That's a really, really great question. So again, it depends on your age. It depends on if you've got chronic medical problems. If you've got underlying asthma, chronic obstructive lung disease, any underlying lung issues, you've got to be more vigilant about, how you're feeling. If you're having extreme shortness of breath, if you're having trouble breathing, that is a very common symptom. If you cannot have a conversation because you're so short of breath, you need to go to the emergency room, right? If you hear yourself wheezing, or you feel like you're like just choking, can't get any breath of air in, you need to go to the emergency room. Like, we don't want you, suffering at home if you can't breathe. That's very important. Fevers, fevers you can manage at home. You can take Tylenol, we can bring your fever down. But if you're having some of these other symptoms, if you're passing out, if you now are becoming dehydrated because you're not able to eat, if you're having nausea, vomiting, and you're just, vomiting all the time, you need to go to the emergency room. If in doubt, go to the emergency room. People
are saying boil some lemon, lime, put thyme, sea salt, all of this stuff in the water and boil it, put your head over it. Do you find that this would relieve some of that, or are you saying just go to the hospital?
Well, if you're able to try some home remedies, right, if you're able to do some of these things at home, and that helps, great. But I always say, listen, if you are tested positive for the coronavirus, So we already know you have it. The whole reason we're telling people to obviously not go to the emergency room is because if you don't have the coronavirus and now you go to the emergency room, you're possibly likely to get exposed to it. Now you may have coronavirus, right? But if you're already positive, we know you already have a positive test result. And now we know that you're struggling to breathe. You've tried some at-home remedies, like you've tried taking Tylenol, your temperature's not coming down. Now you're having extreme shortness of breath. You probably need some oxygen. You probably need some fluids. Maybe you need IV antibiotics, right? That's when we want you to come to the emergency.
Right. So in other words, if the home remedies are not working, then it's time to go.
Correct. But don't wait 3 or 4 days where now you can't even get out of bed and now you're just that much worse. You know what I mean? Like, we don't want you coming unnecessary to the emergency room just because that's kind of problematic and that puts a stress on the healthcare system, especially because we really just want to really, really sick people. But a lot of people, it's a good question. Am I sick enough to go to the emergency room? They don't know that, Talk to your primary care doctor. If you feel like you're having trouble breathing, make a quick call to your primary care doctor, the person that diagnosed you with coronavirus. Say, listen, this is what's going on. These are my symptoms. What do you think I should do? And they can guide you and say, you know what, this is really getting worse since the last couple of days I've seen you. Yes, go to the emergency room. Or they may say, you know what, let's try this other medication. Let's call an inhaler for you. Let's try something else and see if that works. If it doesn't work, then maybe you need to go back.
I understand that they have a trial medicine that they're using now, a few different ones. Are they using these trial medicines in all of the hospitals now for maybe even some of the worst coronavirus patients?
Unfortunately, different hospitals are doing different things, and it is unfortunately trial and error, right? There is no standard of protocol of what treats coronavirus, right? There's some hospitals in New York that are doing IV vitamin C, right? But that's not all the hospitals in New York. Some are using the hydrochloroquine. Some are doing like azithromycin and Tamiflu. So everybody's kind of just experimenting right now until the WHO and the CDC can come up with guidelines that say this is the definitive treatment for coronavirus. Unfortunately, that takes data, that takes studies, it takes a long time. So maybe 6 months from now, all these patients that we're treating will find the perfect regimen. Some regimens work better for really sick coronavirus patients, and some regimens work better for the less sick patients. So unfortunately, we're still trying to figure that out.
I hope that they find something soon because it seems like people are dying more and more. It's a shame that so many people have to die before they find a solution for this. Yes, I know. It's unfortunate, but I agree. I hope that they figure all of this out pretty soon. Well, Dr. Gandhi, I enjoyed our conversation. Why don't you let everyone know how they can get in touch with you? Well, thank you. So you can find me on the web at www.drbindiamd.com. My practice in Atlanta is called Revive Atlanta MD in Decatur, Georgia. You can find me on Instagram at Dr. Bindiya MD, and on Facebook at Facebook/Dr. Bindiya MD, and then our practice handle is Revive ATL MD. So, I post a lot. I contribute to Mind Body Green a lot and a lot of different online outlets, media outlets. So you can find a lot of information out there, especially during the coronavirus time. Well, thank you so much for joining us. Well, thank you so much for having me. I appreciate it. And thank you guys once again for joining me on the Yvonne Candy Show. Stay safe and always live the life you deserve.
Thanks for listening to the Yvonne Candy Show. Want to know more? Check out YvonneCandy.com.